We're going to talk about renewal fair market value. We'll talk about when the renewals start in year 2, and then we'll toss in just a couple quick blurbs about Medicare supplement commissions. So for those who haven't joined me on webinars before, we do these every Wednesday and Thursday. I'm trying to decide during AEP. Obviously, it's a busy time. We might not do them during AEP, or might cut them down to once a week, or maybe every other week or something. But throughout the course of the year, we always do them on Wednesdays and Thursdays at 1. If you want to join us for a future webinar, but you can't make it, all you really need to do is register for it, because if you register but don't attend, you'll get the recording automatically. So anyway, if you're not seeing our emails that go out with the invites, just call us, let us know. Maybe it's going to spam, or maybe we need to change the email address. Lastly, if you have any questions during the webinar, just please ask them into the webinar in the question section. I definitely will answer them for you at the end. And other than that, I think we'll get started. These webinars aren't long. This one will probably be about 15 minutes. So, won't keep you on the phone very long. Okay, so just to get started, the 2022 compensation is out. Obviously, CMS is the one that regulates and approves compensation. So these levels I give you are not Crow levels or anybody else's. They're the max allowable by Medicare themselves. And I might add that this information is general information. You can find it. It's public. You can find it by Google searching. Like if you Google search Medicare Advantage Commissions 2022 Crow, it'll come up. Or if you just do Medicare Advantage Commissions 2022, it'll come up by a bunch of organizations, including CMS themselves. So you have what's called the national level for commission, and the national level is all the states that aren't listed below. So most of the states are just thrown into the national level bucket. States like New York, for example, Virginia, Florida, they all just fall on the national level. So if you don't see them below, that's why. So the national level commission for 2022 is going to be $573 for a new MA, $287 on the renewal. And obviously you don't have to do anything when it just automatically renews. You're going to get a renewal of $287, but that renewal will be paid as earned over the course of 12 months. I'm going to give an example of that in just a few minutes later in the slides. Connecticut, PA, and DC are another tier that's the second highest tier for commission. That's going up to $646 and $323 for a renewal. So any cases written in those states, that's what you would get for comp. And then, of course, California and New Jersey have always been the highest commission. They continue to be. They're going to be $715 new and $358 renewal. Puerto Rico and U.S. Virgin Islands, $394 and $197. I get questions about this sometimes, and the interesting thing is there'd be a lot of business to write in Puerto Rico and the U.S. Virgin Islands if there was more product available there. So the commissions are lower, but there's really very little agent or agency competition there. But the problem is sometimes there's few or no product offerings there, so it makes it difficult. I mean, Puerto Rico for a couple of years had product, so did U.S. Virgin Islands, but it can be hit or miss on that. So, but nonetheless, if somebody ever wanted to, and if there was product available, that would be a great place to write business, even though it's less, because you would certainly make some money on it. And I decided to throw PDP commissions in there, so standalone drug plans. PDP commissions for 2022 are the news 87. I think that's up like $5 from the current year, and the renewals going to 44. Same rules as writing an MA. So rules are different. That's how it works. 87 and 44 on a standalone PDP plan. One thing to keep in mind for sure is AEP. So during AEP, when you write AEP business, so any business you write October 15th through December 7th for January 1 effective, you'll write that business, but that won't pay out right away. Like usually, like a United Healthcare or an Aetna, they're very quick to pay, except for during AEP, they won't. So anything you write during AEP will pay out sometime in January. So there's definitely a delay there while you're writing during annual election, the annual election period. But this wouldn't be applicable to supplements. So people that are writing supplements during this time, they're going to still pay as quick as quick as they do like normal. or if somebody's new to Medicare, so meaning if you got somebody who's turning 65 for November 1st or 12/1, that's going to still pay out on the normal schedule, but AEP business will not. That is a good reason to write supplements, and also a really good reason to write ancillary products like maybe a hospital indemnity that isn't affected by the CMS rules during AEP, so you can keep your cash flow going. And of course, things like annuities and life and that kind of thing aren't affected by it. So it's a good idea to cross-sell those things if you can. So how much do you get paid on your MAPD and PDP? Well, I gave you the levels, but it depends on the type of sale. So they might list what the max commission is, and that's what's being paid out. But the type of product you write, I guess the situation of when you write the product will have a bearing on how much you're actually going to get. So the easiest one is full initial rate with full true-up. So those who haven't written Medicare business yet, Medicare pays on Advantage plans and PDPs in two halves. They pay an initial commission, which is half, and then if it was brand new to Medicare, they'll pay a true-up, which is the second half. It comes in two installments. It's not all paid at once. I get a lot of questions from agents who say, hey, I wrote a new one and I didn't get paid enough, and I always tell them, well, that you got to wait for your true-up. That'll come in a few weeks, or depending on the carrier, maybe 3 or 4 weeks. So as an example, if you're write a new MA, so they're brand new to Medicare, you write them, you'll get a payment of $646 in Connecticut, for example, and it'll be paid in 2 installments. So that's how that works. Now, what about if you have an unlike plan change? Because my first scenario was just for brand new to Medicare, whether they're maybe turning 65, or maybe it's somebody who's 68 but didn't have Part B and they just got Part B because they lost work coverage. Those would be considered new. New unlike plan changes are a different category. So the scenario where somebody's got an MA or an MAPD and you switch them to PDP, or maybe they have a drug plan only and you switch them, they go original Medicare or a supplement in a drug plan, and you switch them to an MA or MAPD, or not that there's many of these left, they have a cost plan and you switch them from the cost plan to an MA or MAPD. That falls into a different category because there's 3 categories. That is full commission, but it's subject to pro rata. So they were new to Advantage, but they had a PDP, when you enrolled them. So you're going to get full commission, but prorated. And I gave you an example of that. So you got the person who you write an Advantage plan, they had a PDP, and you're thinking, well, I'm going to get a full commission. Well, you are going to, sort of. If you write that person that you switched from a supplement in PDP to an Advantage in January, you will get the full commission. But it's subject to being prorated because they had a PDP when you wrote them. So because of that, in this example, let's say you write somebody for July 1 start date, it's full commission but prorated. So you'll get the $646 technically, but they only give you that on a prorated basis. So in this scenario, the person had a plan for July 1. Well, you're already 6 months into the year. So what they're going to do is they're going to pay you $646 divided by 2 because you only get 6 months worth of it. So you're going to get $323 because it was subject to pro rata. Your renewal is going to start in January. So you are getting reduced on your commission because they had a PDP when you wrote them, and you're going to get $323, but at least your renewal is going to start January 1st. So I want to make that distinction. Brand new to Medicare, A and B turning 65, brand new maybe to Part B and they were on a group or work plan. You write them an Advantage plan, full commission, no pro rata. However, if they weren't brand new, if they were on a PDP already and you move them to an Advantage plan for the first time, prorated. Then you have same plan changes. So meaning you switch somebody from PDP to PDP, or you switch them, they're on an Advantage plan and you switch them to another Advantage plan. So that is going to be a renewal only. So they're not paying you a full commission on that because they had an Advantage and you wrote them another Advantage. So it's renewal only and it's prorated. So the example I gave, the renewal rate, which is obviously half the initial rate, you switch somebody on January during AEP from their existing Advantage plan to another one, you're going to get half a commission, $323, renewal rate only. To use an example of how pro rata comes in, to make it worse, so to speak, let's say you switch somebody from during the OEP from one advantage to another. Well, you're going to get the renewal rate only, and it's going to be prorated both. So in that scenario, you enrolled them April 1, so you're only getting 9 months worth of enrollment, so to speak. So you get the renewal rate of $323, but they're going to reduce 3 months out of that commission because it's April 1st, and lo and behold, you wind up with the pro rata getting a $242 commission. Hopefully that's clear. If you have questions about it, certainly give me a call. Then you have fair market value renewal. So this fair market value started a few years back. So what that means is when CMS comes out with commissions, they say here's the max allowable fair market commission amount for new and renewal. So companies, traditionally, they've changed the existing renewals to match the current CMS renewals. So if you wrote somebody 4 years ago, obviously the commissions were lower 4 years ago. The max allowable CMS on the renewal was less. But that person you wrote 4 years ago, usually the company upgrades that person to match the max allowable renewal commission. So maybe that person you wrote 4 years ago, the renewal rate on them was $280. Well, when it renews this year, you should be getting $323 for it if you're in Connecticut, for example, because that's going to be the max fair market renewal. Companies do match this, however, they don't have to. You did have some scenarios, like United Healthcare, for example, a couple of years ago just changed that. It used to be when you had a renewal, it just stayed at whatever it was. But a couple of years back, they started increasing those to the fair market value, so your renewals every year would go up. Most companies do it. There are a few small ones that don't. In some states, usually that's limited to very state-specific or regional carriers who don't increase the renewals to the fair market renewal value. So how's the renewal paid? So we'll use an example. Let's say you rate somebody in January, brand new to Medicare, you get the full commission. And then following January, it stays on the books. Well, you're going to get paid the renewal because it's on the books for a year, and it's staying on the books. So what they're going to do is they're going to pay you the renewal as earned. So again, sticking with the Connecticut example, the renewal rate's $323. That's going to be paid as earned, meaning you're going to get it in monthly installments. So $323 divided by 12 is going to be $26.91 a month on the renewal for that case. There are a few exceptions to this. One of the closest to us and notable ones is Emblem in Connecticut. They don't do that. They don't pay the renewal as earned. They front the renewal, so they advance the renewal. So you actually will get the full renewal rate, $323 with them. But most carriers, it'll be as earned. So this brings the question, when do renewals start? Well, they always start January 1st, no matter when you write the case. So it makes writing new to MA cases really valuable when you write them later in the year. To give you an example, let's say you write a case for October, November, or December 1, brand new to Medicare or new to Medicare off a group plan. You're going to get the full commission because remember, that's not subject to being prorated. So you get the full $646, and as kind of a double bonus, your renewal is going to start as earned January 1st. So you write a 12-1 case, $646 on in December. And then the as earned renewal starts in January. So you're almost in a way getting paid twice on that. So we see a lot of agents that will load up and try to really work T65s hard for the last quarter of the year because they know they're getting a little extra commission when they do it. Talk about Medicare supplements for a minute. Medicare subs, and this varies greatly by carrier and the state you're in, but they are not regulated by CMS. So writing a Medicare supplement is not subject to the rules of AEP or OEP or special election. You can write somebody a supplement whenever you want if they have Medicare A and B only, for example. But again, it's going to depend a lot on the carrier and a lot on the company, on the carrier and the state you're in, rather. So commissions will range from the low end. I've seen them as low as 14%, and that's 14% of the monthly premium, up to, with some companies, 27%. And again, depends on the company. I said some, but it's probably most companies pay on a 9-month advance, while there are a couple out there that pay all the way on a 15-month advance. So you write a case, they're advancing the commission 15 months. I never cared for that too much kind of like the 9-month, because if the case doesn't stay on the books, you're subject on a 15-month to a pretty substantial chargeback. Some carriers don't pay percentage, they pay a flat dollar amount. And usually when you see that, it's in a guaranteed issue state. So for those not aware, there's 4 guaranteed issue states: Connecticut, New York, Massachusetts, and Maine. In those states, supplements can never be underwritten, ever. So in every other state, somebody, let's say, takes a Medicare Advantage plan, and then 4 years later they get sick, and let's say they're in Virginia. 4 years later they get sick and they call you and say, I want to move to a supplement. Well, it's not a guaranteed issue state. So in Virginia, that person who had an advantage for a bunch of years and now wants a sup, they're going to be subject to medical underwriting to move to a supplement. That can't happen in Connecticut, New York, Massachusetts, or Maine. Supplements can never be underwritten there. So it's a lot easier to place a supplement. However, there's a cost to pay for that. The supplements in those states tend to cost a lot more than they do in an underwritten state. Most companies on their commissions, they will go down after year 6 or 7. So if Cigna says, I'm just making this up, but if Cigna says we're a 22% commission on a fully underwritten supplement or a brand new to Medicare supplement, it'll be 22% for the first 6 or 7 years, and then it'll go down to something lower thereafter. And usually it ratchets down a couple different times. Like in year 10, it'll go down again, for example. So depends on where you are, but in guaranteed issue states, usually the supplements are flat dollar amounts, like United and the Blues in Connecticut and New York. They're flat dollar amounts. They're not percentage based. All right, I mentioned this one would be fairly quick. Couple final thoughts. Check your commissions. That's a big one. I know a lot of people will think, well, it's a big insurance company. I read an Advantage plan or a supplement or a Part D. I'm going to get paid on it. And that's not always the case. In fact, they have about a 10%, some are better than others, but there's about a 10% error rate there. So I would say definitely check your commissions. Now, it can be tedious to check all your renewal commissions, but usually once it's on the books and you're getting paid, there's not mistakes with the renewal. The most important one to check is the initial. So, for example, when I was writing business, what I did is we'd process the application, whether it be online through like Connector, Sunfire, or paper, whatever it was, or maybe went through one of the carrier apps, and then I'd have somebody in the office just check once that case got issued to make sure we got paid on it. And again, we found about 10% of the time you didn't, and there was some mistake, so to speak, internally, so you didn't get paid, and then we'd get it corrected. But if you don't check, you're going to miss out. I mean, ideally, you'd like to check on all your renewals too, but if your book's big, that can be quite a problem. And usually there's not mistakes made on the renewals once you're getting paid. Medicare Advantage commissions are set by CMS. So that limits how much a street level commission is. Those are the levels I gave you for 2022. That's the most an individual can make. But certainly there are higher commission levels for if you move up to agency level contracts. So if somebody's a general agent, a master general agent, or a senior general agent, they're getting overrides above and beyond the street level commission. So usually what determines if you can be a GA, MGA, or SGA is the number of subagents. So GA is pretty easy. MGA usually is around 10 subs. In SGA, usually they want to see 25. So that's what kind of dictates if we're able to move you up to a level is the number of subs you have. Quick note on chargebacks. Rapid disenrollment. So I used to even myself think, as long as my case was on the books for 3 months, I would avoid the rapid disenrollment. And actually, I was thinking incorrectly. Rapid disenrollment is any case that doesn't make it into the 4th month. So it's really got to be effective for 4 months to avoid a rapid disenrollment. So if after the 3rd month that client switches or terms or goes to another plan, and they were only on the books for 3 full months, you're still subject to a rapid disenrollment, meaning they're going to charge the entire commission back, the carrier that is, because it didn't go into month 4. So you really need 4 months to avoid it. And rapid disenrollment means they take it all back. It's not prorated. They just take the entire commission. There is not, however, a rapid disenrollment when the agent initiates the change. So let's say you put somebody on a plan for, you put somebody on a plan for 10-1, and then in January you switch them to the same carrier but with a different you switch them to the same carrier but with a different plan, or maybe you move them to another carrier. In that scenario, you're not going to get a rapid disenrollment. However, you will get a prorated chargeback. So to use the example here, let's say you wrote somebody in January. Okay, bad example, sorry. Let's say you wrote somebody in July. Wrote them in July, and then when January comes, you move them to a different company. But when you wrote them in July, they were brand new, so you got a full commission. Well, in January, because you moved them to a new company, they weren't on the books for 12 months. So you're not getting a rapid disenrollment, but you're going to get a prorated chargeback. So you're going to lose 6 months worth of that initial commission. You're going to get it back, however, though, when you write the new plan and get the renewal commission. So you do get prorated chargebacks if they've been on the books for less than 12 months. I think that's all. Yes, that's all we had. Let's see if we have any questions. I don't see any questions right now. I'll stay on for another minute or two. Usually this one does generate some. I tried to clarify this because, again, it gets confusing with new versus new but prorated versus just switcher, advantage to advantage. But those are the three different categories you got to pay attention to. Other than that, I don't see any questions coming in. So if you have any questions later on that you're not thinking of right now, feel free to call us or email us. Let us know if you have any. Tomorrow, we're going to talk about just really kind of more geared towards somebody a little bit newer. It's about sales proposition, selling advantage versus supplement, the pros and cons of both, and kind of explaining that to a client. Okay, we do have a question. What's the easiest way to track sales? Well, that's a good one. The easiest way to track the sales really are looking at commission statements. So what you'd want to do is log into the commission portals for your carriers, and most of them are pretty easy to get into at this point and fairly easy to read. But basically, when you write a new case, you want to make a note. Maybe a month later, you check on that case, log into the commission portal, make sure you got paid on it, and you should be good. Because once you get paid initially, then the renewal doesn't usually error out. If there's going to be a mistake, it's going to be on the initial. Good question, though. Okay, it looks like that's all we have. Appreciate you joining me today. Hope to see some of you on the webinar tomorrow. Oh, we got one more. Okay. You mentioned 25 agents for SGA and 10 for MGA. How many for GA? Okay, so just to repeat the question, the agent's asking, I said to get an SGA level, you need 25 contracted and certified agents. So we'll go through this. So for SGA, you need 25 contracted and certified agents with that carrier, like Aetna, for example. Agents will say, well, I have 25 agents. Yeah, but only maybe 12 of them are certified, contracted and certified with Aetna. You need 25. For MGA, you need 10. GA depends. Most companies for GA just want 2 subs. That's all you need. United and Humana for a while were asking for 5. We've been messing around with that and have started to realize we can put you in for GA with them with less than that now. But at some point, they're going to double check and see that you have the minimum. So that can be a bit flexible, to answer your question. So anywhere from 2 to 5, depending on the carrier. But the ones that have required 5 traditionally are kind of letting us put some in sometimes with 3 or 4 now. Is there anything you can do if the carrier doesn't pay the new renewal rate for the next year? No, is the quick answer there. If they're not adjusting the renewals to fair market value, and that's their policy, it's completely their choice to do that. So there would be nothing you could do about it there. Now, maybe it was a mistake. So if that carrier traditionally does always increase the renewals to match fair market value, then that's a one-off and you can try to fix that mistake. But if that's just their policy, that's their policy. They're not forced to do anything. Somebody asked, are they the same general numbers for the GLIC RX program? No. Completely different. It would be too much for me to get into that on the call. But that's GLIC has nothing to do. GLIC is an insurance, has nothing to do with CMS, so not even comparable to Advantage. Completely different. But call us for questions about that. Okay, great questions. If there's nothing else, I think that looks to be it. Okay, well, thanks for joining today. I appreciate it. And remember, the recording will be sent out to everybody. And I always mention this, but never get any response really. If anybody has any suggestions for future webinars, please just call us or email us, and we'd be happy to look into doing that topic for you. Again, we do 2 of these a week, so gives us plenty of room on the schedule to put something in there. So if there's something you want to hear about, whether it be Medicare or really any kind of insurance product, we'd be happy to do it. So let us know. All right. Well, thanks for joining and have a great day. Thank you.